Hi, everybody. Good morning, good afternoon, or good evening from wherever you are located at. Um, my name is Anika Martin. My pronouns are she, her, and I am attending this summit from Honolulu, Hawaii. I am the Ryan White Administrative Manager for the Hawaii Health and Harm Reduction Center, and I am also the Awareness and Education Work Group Lead for Hep Free Hawaii, which is a local coalition dedicated to eliminating hepatitis in the state of Hawaii. But so today I have been given the opportunity to help moderate the session titled Best Practices. So in this session, you will hear best practices and barriers from our panelists when it comes to screening, testing, and vaccination for hepatitis B. We'll explore practices that worked well while serving diverse populations and gain insights on the learnings utilized in the hepatitis B space. So we'll go ahead and begin with introductions, then move into moderator-led Q&A sessions, then followed by questions from our participants. So with that, let's go ahead and begin with allowing our panelists to introduce themselves. First, we have Thaddeus Pham.
Thanks, Anika, and good to see you again. So hi, everyone. Aloha. My name is Thaddeus Pham, he, him. I'm the Viral Hepatitis Prevention Coordinator with the Hawaii State Department of Health Harm Reduction Services Branch. It's a mouthful already. And I'm also co-director of our Hep Free Hawaii Coalition, as you can see the screen behind me. Many people in the community call me the Queen of Hepatitis for Hawaii, and I will respond to that, as well as Your Highness or Your Majesty. But to give you a little bit of feedback in terms of where my hepatitis journey came from, I didn't realize this, but actually my uncle had hepatitis B, and he unfortunately passed away before he even started the work, without even knowing what hepatitis was, due to liver-related issues. And he left behind a wife and 3 kids, my cousins. So, it was really a personal issue for me, but also I think as someone who's rooted in social justice, working in harm reduction and LGBTQIA plus health, and as the son of Vietnamese refugees, all of the work that I think we're all doing in hepatitis and TB really is social justice work through the lens of public health. So for me, my journey is really how do I align justice and health and move it forward to really do all the things that we've talked about for the past 2 days, and that have been really moving to hear. To give you a little bit of a background very quickly, our coalition, which we started in 2011 with Heather Lusk, who couldn't join us today, started over 11 years ago. And although this panel is called Best Practice, I kind of want to also give space or maybe have us think about maybe emerging practices, right? So sometimes these are just things that we tried over time, and we continue to build relationship, as the panel before us mentioned. And over 11 years, I think that's what really is our success, is just investing in our communities, whether it be through time, space, and sometimes if we have it, a little bit of money, to really empower our communities to move forward and to really promote justice in their own communities. So I'll stop there, but so glad to be here and so glad to hear from my fellow panelists. Thanks, Anika.
All right, thank you so much, Thaddeus. Next, we'll have Dr. Amy Trang introduce herself.
Hi, everyone. I'm Amy Trang. I'm representing HBI today. Jane Pan, who's the executive director, cannot be here today, but she did want me to also mention that HBI is actively hiring or searching to hire a program manager. So I'm going to plug that in for her. I've been a program development consultant for HBI since 2013, working alongside Jane Pan. And recently, in the past year or so, have been in the interim program manager position, helping Jane in a lot of transitional management. If you did not know, Jane is retiring at the end of this year. This is something that we've been planning for the last 5 years, and she actually wanted to retire before the pandemic. But related to our discussion today, because of the pandemic, there was a surge in a need in addressing not only COVID-19 issues, but as well as the hepatitis B, C, and HIV work that HBI has been doing. So we'll talk a little bit more about that when we get into the best practices. But thank you everyone for having me here. And personally, you do know me also as the administrator for the National Task Force on Hepatitis B, which is a volunteer-based national coalition established more than 20 years ago in 1997. I am very passionate about promoting hepatitis awareness as well as liver cancer prevention awareness, because I do have personal family and friends affected by the diseases. Thank you.
Thank you so much, Dr. Trang. And then last but not least, we have Dr. Oyu Tumurtuya.
So, okay, hi. My name is Oyu Tumurtuya. I'm a clinical pharmacist based in Chicago. I'm also the founder of Mongolian Community Health Network, a Chicago-based organization. We do community outreach, testing events for the Mongolian community. I have been doing the community work almost 5 years or so now. I think I was first introduced into the hepatitis B and just through my personal connections to the community. There's a huge number of Mongolians that have a hepatitis B and living in the US. So my goal was to communicate them to the networks that they can get some help in testing and medications and things like that, access to healthcare.
All right. Thank you so much, Dr. Tumurtuya, for introducing yourself along with the rest of our panelists, excuse me. So with that, we'll go ahead and begin with the questions and answers session. Our first question for you all is, what are some of the best practices that have worked while working with a novel outbreak? We can go ahead and start with Thaddeus, and then we'll just do round robin.
Yeah, great question. And this is why I kind of set it up to talk about emerging practices, right? So in a sense, when the COVID-19 outbreak started and hit Hawaii, you know, there was no best practice. So for us, we did what we always do, I think, in hepatitis and TB in the community setting, is really just respond and look around and see what opportunities there are and what challenges are and try to meet those challenges and opportunities. So for us, much like folks have already mentioned, we switched a lot of our things to Zoom or to other online platforms. I think that was something that was really important, was to provide those technology and that support for our communities, but really to let them take the lead. So I want to give a shout out to Rensley and Kenson Alec, who is from our Marshallese and Chukis communities. You know, we were able to kind of support them and give them the tools and the space to have Zoom meetings, but they were, like Turner had mentioned, they were the ones who were kind of engaging with communities because they know them best. And they knew the times and the places in which to engage communities in as, you know, COVID-19 continued to happen in Hawaii. So for example, I'll note like what they did is they reached out to their local faith-based organizations, so local Micronesian churches, and try to integrate into their Zoom kind of church proceedings, right? So every Sunday they would just the pastor would ask folks to stay on a little bit longer to learn about hepatitis. And also I would note all the other issues, I think Ruth had mentioned in the last panel, you know, the other issues that are important to people at that time, right? So not only COVID-19 vaccine, but really just, you know, concerns about food, right? Food security, or concerns about when to go to primary care, things like that. You know, being able to address the comprehensive health needs allowed them to feel like their needs were being met, and also to integrate hepatitis B in a really meaningful way for folks. So I really think just responding and really taking the lead from our community members, as we've already done, but just giving them the tools to do it in this novel space while maintaining safety. And I would love to hear what my co-panelists have, because I'm sure there are some great things that came out from there as well.
So I'll go next, and then you can chime in. HBI, what we did during the pandemic was really, it started out contacting all of our program participants when there was the shutdown and we weren't able to do a lot of in-person stuff. We were just calling and following up with care and seeing how everyone was doing, and then personally providing them with the information about COVID, how to keep themselves safe and protected. Fortunately, after that, we were given several opportunities to do COVID vaccination outreach. So we had, started this initiative even before funding, but it was like very relevant to the communities that we serve because they were at risk, they were vulnerable, and then they also had language barriers to receive information. And so it was, kind of HBI's ongoing mission to serve these communities and make sure that they had health equity access. Along the way, we also had a board meeting and decided we had to revise our mission because we are no longer just in the hepatitis space. We were getting ourselves into infectious disease space, and we were very effective in reaching out to these populations. So that was something that came about in terms of pivoting and making sure that structurally we could engage in these activities in a more sustainable way. In addition to that, we were looking really at how the community was going to react after, things started opening up again. And of course, there's a lot of hesitancy to go out and do community events. And before the pandemic, that's how we thrived. We were just like at community events, providing free screening and testing. And here we are faced with, people being hesitant to go out in person. So we started offering what we called the hybrid approach, the screening and testing, allowing people to do registration online and then contacting them directly and providing them with lab slips so that they can go to a nearby LabCorp and then get their blood work done for the screening and testing of hepatitis B. What I would say was really nice about some of these funding opportunities for the COVID vaccination was they did allow us to creatively think about incentives for the community if they were going to get vaccinated. So, at first we started out with gift cards, but then we really thought about, okay, how are we going to sustain our operations? And we already have very limited funding when it comes to screening and testing for hepatitis B. Fortunately, we were able to use incentive money to provide the additional comprehensive screening that it would include hepatitis B, C, HIV, glucose, cholesterol, and not pose a stigma for the target population. And that was really important because we wanted to make our community members feel like they were having access to an overall, health screening, not so much as, they were being specifically targeted for certain diseases.
Okay, I think for me, during the pandemic, I think I approached it from a community education point of view. I think a lot of people had misinformation. They had a lot of fears and anxieties. But we also had a great resources in Chicago, where patients can go get tested or get vaccinated. So I was able to share, some information as far as where they could go. But my concern during pandemic was that, people weren't getting tested for their hepatitis. How can we meet that, demand? Because people are still having hepatitis. That you don't just not have it for 2 years. So we did Zoom meeting. I wasn't even sure if people would even join, but it, just more of an information session where people can go, what are the protocols at the clinics are, so people can expect. Everything was appointment based, how to make an appointment. So those details were provided during the Zoom meetings. And after, I think last October, when things definitely opened up better, we resumed outdoor. I guess we resumed the testing, but we had to do it outdoor. Testing event outdoor in October in Chicago was like a challenge of its own. But yeah, it was like October 30th or something, and I'm like, this is going to be so difficult, having people wait outside and then bringing them into the clinic one by one. But hundreds of people showed up. I'm very, very grateful that people trust me and show up to my events. But yeah, COVID definitely threw some challenges. But I think we were able to do some things and work around it for sure. Okay.
Yeah, and I also want to add,
yeah.
It's nice that we all have this network nationally, because we get, when we're serving the ethnic communities, we get questions all the time about, do you have this in, this state or this area? And it's so nice, like OU, with the Mongolian community.
Collaborating.
They come down to DC and we send them to Chicago, and even Thaddeus, I know we like chat about where are we going to get services and how we can connect people to resources. So I think that's really nice too, is to be able to stay connected with all of our partners here. And like just this past Sunday, we did a screening event in the Thai community, and somebody in New York came down and said, what if I find out that I test positive today? Where am I going to be linked to care service? And we're like, oh, the Charles B. Wong community, they have the free health clinic in New York. And, I was able to give that information out. So I think it's really nice to stay connected and have this network.
Yeah.
I just want to echo. Oh, go ahead, OU.
No, I was just going to add that, collaborating with the national organization is essential. I actually cannot do anything by myself. Amy, you are my go-to person. But
I'm happy to be.
Yes, thank you, Nelly. We get, because I'm a Mongolian person, I do get, people calling me from all different states. So I definitely reach out to Amy or, everybody else who is in that particular state. I also want to talk to Thaddeus. I went to Hawaii. There's a need. So with that, I'll hand it over to you.
Thanks, OU. I look forward to seeing you in Hawaii one day. I just wanted to amplify what Amy had said. I totally agree. We reached out to, I think, many of you, especially Hep B Foundation, for things like other languages. So sometimes we get requests for languages that are that we don't normally see here, but that do come up because we do work a lot with our refugee immigrant communities. And also just note, a lot of times our folks end up going to other states. So I do see Richard Smith on the line, one of our powerful storytellers and lead for our equity work group. And he's now in Michigan, but he still stays involved in Hawaii and is really kind of bridging that gap and kind of trying to share resources among states. So, maybe I think definitely one of those best practices is just reaching out to this network of people that we're all part of. That's so valuable.
All right. Thank you so much to that very insightful discussion with our first question. Somewhat also related, not directly related to the outbreak, but our next question is, what are some general best practices and barriers when it comes to screening, testing, and/or vaccinating for hepatitis B?
I'm just going to jump in and say the education is so important. Oh my gosh. And like that is saying, having that in different languages available is super helpful, because most of the time when we're offering these free screening events, people are either jumping to it immediately because they don't have health insurance, or they're kind of hesitant and saying, well, why do I need to get screened and tested? And I have to go through this opportunity to share with them, well, if you were born outside of this country, especially in an Asian country, you may be at risk for hepatitis B or C, depending on, when you were born and where you were born. And it's recommended that at least once in your lifetime as an adult, you should get screened and tested just so you know your health status, so that you can definitively make a decision of how do you want to take care of yourself. And if you do happen to test positive, this is something that you can get a treatment for, and possibly cured. And, trying to downplay the stigma involved in how you get, or how you may have gotten affected. And a lot of times I go back to the story of, a lot of people don't know that it was mother to child transmission. And, that's most of the time what has happened in a lot of these Asian countries. They're not promiscuous or anything. It just happens to be that they did not know, and they have been passing it down from mother to child, generation to generation. And then that gets people to think, oh, well, there's nothing that I contributed to this, so why not just get tested for? So that's trying to get people more educated and understand, that they just need to know the health status.
I mean, I guess I could also emphasize educating, community education as well. Just, in Mongolian community at least, hepatitis is an epidemic. It's been an epidemic for decades. So in some sense, Mongolians do have, I guess, higher health literacy when it comes to hepatitis. But there are certain challenges with, I think, with the newer generations, where they think they don't have it. They're not willing to get tested because, well, hepatitis is like, my father's generation, grandfather's generation, I probably don't even have it. But because the disease circulation is so high, that the likelihood of somebody getting hepatitis is extremely high. And the common, transmission isn't just, needle sharing or, the common way in the United States. It's like going to the dentist is an exposure, getting a tattoo is an exposure. So people aren't aware of that. So for me, it's an education, encourage them to get tested. But that's really the best practice, education, and getting people motivated to get tested. Yeah.
Yeah, I would definitely echo education as an important piece in the community, both for our providers who see folks and also the community themselves and their leaders, especially like our faith-based leaders and other kind of folks that are kind of the go-to people. Also note in terms of language, what we've learned, and I'm sure everyone else already can speak to this, but really just to acknowledge that not everyone can even be to read their own language, right? Some folks are not literate in their language in terms of reading. So creating opportunities or visuals that are culturally congruent, right? So for us in Hawaii, a lot of our communities, learn or share information by talk story. So we just try to create materials that are more conversational. For example, we love Charles B. Wong's comic book. I think that was really a beautiful thing, and we use that a lot. But also just creating things like storyteller videos, like the Hep B campaign or the TB stories are really powerful for folks, so they can just see and hear someone talking is a really great way of disseminating information and kind of also building new leaders in the community. In terms of screening and vaccination, also add just integration, right? So where are the people already going to seek health services and how can we integrate there? So in our federally qualified health centers, of course, but also I'm just thinking, in Hawaii, I'm not really sure how integrated Hep B testing is in our TB clinics. How can we really cement that co-location of screening or TB screenings with Hep B? So just really kind of putting that together. And then finally, when we can't integrate, right? Not everyone comes into these settings. How can we bring the services to where people are at? Like the community screenings that Amy was mentioned. So for example, I'll share in Hawaii, something that came up recently that we're trying to work on is screening for undocumented fishermen who are commercial fishermen from primarily Southeast Asia who are technically not even allowed to be on US soil, so they just stay on the piers. But they do have health needs, so how can we integrate hepatitis B and other services for those folks while they're here, right? While they're on the pier. So there's just some thoughts. So integration, meeting people where they're at, of course, and then talk story, non just reading opportunities.
Yeah, and I'll also add to the language piece. We find it extremely helpful to be able to recruit volunteers who can interpret in different languages. Like HBI has, everybody is multilingual at HBI. And it's super helpful when we're in the community, when we can speak, even if we don't speak fluently, be proficient in trying to communicate in the language that our target population speaks. That's part of the building the trust aspect. I always put my business hat on when I do any program development. I always think in terms of business and return on investment, and how do people market and advertise. And what we do in public health, even though it's social services, we don't think of it as a business model at all. And I think we should, in terms of best practices, really think about, if you were to sell a product or a service, what would you be highlighting? What would you be focusing on? Not just the education piece of it, but what's the benefit to the community? What's the benefit to the individual? And then utilizing as much marketing and education materials as possible. So like Thaddeus was saying, the comic books that Charles B. Wang produces, I think it's wonderful because it's presenting the information in a different way. And, as many different times that you can present the information, one of it's going to eventually stick to the target population. And it's what I call like the Coca-Cola theory, where, if you saw the Coke product being advertised at least 5 times or 3 times, you're more likely to think about, do I really want a Coke product? It's like, you just see it so many times, you kind of feel like, do I want to be in what everybody else is drinking?
This is a great panel. I love all these panelists. So there's so many ideas happening. So I want to respond to what Amy said. In terms of that business model, I think also as part of that, right, considering the importance of investing in our people. So we have many volunteers, of course, but for folks who are storytellers, folks who are maybe not being paid to do this particular work, how do we create opportunities to get them paid in a sustainable way, for living wage, so that investment really does pay off for our local communities, right? And so I immediately think of, for us in Hawaii, we have a lot of community health workers who are also the interpreters. So, this is thinking a little broader, but really, considering like state level policy on reimbursement for community health workers or things like that. So really thinking about that business model. I love that idea, Amy, and how can we invest back in our people to get paid for the work that they're doing?
Yeah, absolutely. I mean, I don't think we could do the work without our community health workers. They put so much time building trust relationships in the community. And it's little things that, you can't really replicate because it's very personal. And I think, you don't want to lose those workers. So once the project's over, you want to think about how do I keep something going so that this person can continue to be on my team. So most definitely, I would say support on that. And that's why I said, at HBI, we had to kind of pivot because there's not a lot of funding out there for hepatitis B. So we have to get really creative, and we have to add other, outreach for other types of disease burden.
Yeah, thank you. Yeah, this is actually a really good discussion. So thank you so much to everybody who chimed in. Kind of gravitating towards the field of TB, Dr. Tumurtuya, you work in a specific community that is impacted heavily by TB. What is your approach when it comes to the disease?
Yeah, I think my approach to every scenario is really try to give out much information as possible. TB is highly treatable disease. I think my goal is to just direct people to the right resources. I think the problem for the Mongolian community, especially that I see, is that people don't realize there are resources out there. So I try to, educate them as far as where they can go and how they can get treated. But yeah, the TB is, another high burden disease among Mongolians in Mongolia. I think, it's a preventable, curable disease, yet it's, very much thriving in Mongolia, mostly because, the lower social economic status, probably lack of funding, government funding and programs, overcrowding in major cities. So things like that is, and then, Mongolia is very, very cold 10 months of the year. So everybody's congregating, right? So we're basically right next to Siberia. So that could also be challenged too. So with that reason, yeah, TB is extremely high. And my goal is to have people get tested and get treated. So that's how I approach TB patients.
Thank you. We have a question in the chat directly related to Thaddeus and the work with testing amongst the fishermen. Do you folks go out to the pier and provide the screening, and where do you refer them if they need additional care for any health issues?
Sorry, I missed that. Yeah, great question. So literally we just started this screening pilot like last Saturday. So it's really new. But to answer your question, well, maybe this actually speaks to what we were talking about throughout the 3 days, is the importance of social capital or relationship capital. So through our ongoing work, through our coalition, we built relationships with our Office of Language Access, and then they actually worked with this volunteer organization called for the fishermen at the piers where they're allowed to be. And so one of the things that came up was, they asked if there was opportunity to do hepatitis B screening and referrals post results. So we were able to kind of work with them over this summer and figure out all these different pieces and logistics so that we could provide free screening through the Department of Health, and then they would actually do the screening, the testing, follow up with results, give them the results with the interpreters and with the blessing of the the boat owners as well. Also offer through some small funds monitoring testing, so we can actually help them with monitoring, and then provide health education and support to kind of at least take care of their liver until they return to their home country, since they can't really access the full suite of care here. Unfortunately, we don't have access. We don't have just Hep B medications available now currently. But we did also, again, through relationship capital, reach out to WHO and CDC Global to work with the partners in country to help ease those referrals. And primarily the folks that we see are from Indonesia, Philippines, and Vietnam. So we're working with them to see what is available, how do we link them back to care in their country to provide services. But at least we can give them the opportunity, as we mentioned, around education, so they know their status and they can make health changes while they're here as they're willing to. So really just trying to give the people information, empower them to make choices. But we're still working it out. So if folks want to reach out later, I'm sure we can share a lot of challenges as well. Great question, thank you.
All right, thank you so much for that question. It's very apparent that you all come from varying sized organizations, whether that be state, local, and or community. So with that said, what makes the work you do successful, and can you provide any advice for those looking to do work on those levels?
I saw it in the chat box. I heard it before. It's relationship building, relationship building, relationship building. I mean, at all levels, it's not just building the relationship with the community members and the patients that you're serving. It's also building relationships with people who enjoy your work, like your work. They want to support your work. They want to fund your work. It's definitely keeping in touch with those individuals who, have family members that have been affected by, the disease burden and want to give back. And how do you reach them? You have to talk to them on a personal level. You're not just sending out these email blasts or newsletters. You're actually having coffee or tea or lunch or dinner with somebody and explaining to them your work. Like I can tell you, HBI, we're screening over 2,000 individuals every year, regardless of the pandemic, because we really believe in it. And, there's like 50 something screenings a year, and we find a way to fund it.
I would also, I would also say, gaining trust in the community. I have been able to communicate with other members of the community, people who organize, different type of events, and kind of sort of, getting my name out there. And it also helps that, I'm a clinical pharmacist, so people can reach out to me regarding different things. So it's more of a word of a mouth kind of thing, and just slowly gaining trust of the community, and people are comfortable to reach out to me. Of course, because I do this kind of work for several years now, I do know the resources. I'm able to give them good health education. So that even furthers, I think, I guess my, I had a COVID shot. I feel like I'm just not doing great today. But everybody get your COVID booster. But yeah, so I would definitely say just engaging with other community members and yeah.
Well, I hope you're feeling better. So we'll send some.
I feel so
healing.
congested, and I feel like I sound so different. You were a little bit more conscious, but anyway.
We'll send you healing from Hawaii. Well, to answer the question, yeah, that social capital, and like when we work with the communities too, like to demonstrate or create mechanisms to show that we're listening, right? That their voices are not just going into a void, but like if someone has an idea and can't do it right away, acknowledging that it's a great idea and keeping that in mind or documenting it so we know that their voices are valuable and that they can see it. So for example, we have like this mega list of all the ideas that our coalition members are always sharing with us, and every idea that we hear we put down so they can see it. So even though we can't do it right away, there's we can follow up with later. And then sometimes when we're able to demonstrate that they are we follow up, then I think that's a big deal for folks. So for example, right now we're working with our Micronesian communities to support sporting events, because for us in Hawaii, for our Micronesian communities, sporting tournaments are where the communities come together and congregate and listen and learn from each other. So having like even Hep Free Hawaii like be a sponsor of like a tennis tournament for Marshallese people is really powerful for them. And then it makes people kind of think about us as a trusted partner, supporting the needs of the community that are not necessarily always specific for hepatitis, is really important. And I'll just note lessons we learned from COVID, because in Hawaii, COVID really disparately impacted our Native Hawaiian and Pacific Islander communities. They identified music events as ways to increase COVID vaccines. So really just listening and taking it in and trying to make those things happen despite all the grant restrictions, right? As Amy said, we just try to make it happen, but as much as possible, show that you are listening, document it to show that the voices matter, and then when it's available, really make it known that it was because community feedback made that happen.
Thank you. You all actually already slightly touched on our next question, but I'm hoping you folks can elaborate a little bit more. What are some practices that you found to work among the specific populations that you serve? So once again, Thaddeus, I know you started talking about the Micronesian community, but I'd love for you all once again to kind of chime in on those specific populations.
I'm going to have to let Thaddeus and OU go first because HBI covers a lot of communities.
Oh, best practice. I think with organizing community events, I think biggest challenges is, I think, just getting the word out, finding a time. I think, I think one of the difficult, okay, most people are working Monday to Friday. Do we do it on Saturday, Sunday, and I have tried varying days. The best day is Sunday. And but I think the key is to get your flyers out early and just constantly promote the event. And it's a tireless work, reaching out to people. I would be texting people all the time. I don't even use social media yet. Somehow I'm on Facebook. So so I think just it takes a lot of time, but I think getting things early, it takes a lot of time to even plan those events. So you want to make sure that your partnering clinics or whoever you're partnering has adequate resources prepared and things like that. So for me, I would say just best practices and just plan ahead and get your flyers out and promote early.
Well, other than what we've talked about, I would say something, maybe if you're doing policy work, is to just sit in spaces where policy is happening. So for example, we might sit on our Immigrant Advisory Council, which affects, multiple issues, but really, but affects on particular communities that we're working with. So in that space, I think it's really important to build those networks and the relationship capital with all of the folks who are the policymakers around immigrant, migrant, and refugee health. I'll also add maybe an emerging practice, or maybe it is a best practice, but we're just starting to explore integration of community education for people who are acquiring English as a second language. I think I actually learned it from Hep B Foundation on a webinar. I think it was Asian Women for Health, I think out of Ohio or something. They integrated Hep B into ESL curricula, which was super cool. So we're starting to kind of explore that. And Anika and I actually are meeting on Monday with our Hawaii Literacy Coalition, which provides support for English as second language folks as well. So, integrating Hep B education and TB education and cancer education into these other spaces where folks are discussing and learning and really already kind of there is maybe an emerging practice for us at least.
So HBI, we do community outreach to the Asian as well as the African immigrant populations. So specific example, this past summer in the Vietnamese community, there was a 2-day music event and which, we never attended before. So it was offered to one of our community health workers who had a good relationship with the organizing committee that we could set up a little table and just pass out information and possibly, have some screening and testing done. And we were very surprised of the outcome. People actually did get screened and tested over those 2 days. And I think it was like 30 or 40 people that we were able to screen and test with the intention that it was not supposed to be a free health screening event. It was a musical event, but we just happened to be there. So that was kind of a best practice, lesson learned kind of situation that we had. In the Thai community, I know Sue Yi is on the line and she's here locally. She has been helping HBI as well. She's been working on reaching out to the Thai and Laotian community for us in the past couple of months. And, her feedback is it's the education. You have to show your face a couple of times before we can actually actively be screening and testing. So, the first time you're out there, you might only be able to attract less than 10 people of interest. But the more times you are out in their community at the various temples, they see your face enough times. So this, for example, this past Sunday, like I said, where I was saying, if we get 10 people screened, I'd call it a day and it would be great. But we ended up screening nearly 40 people. And so that was just like amazing for us, but it was definitely, coming back, don't give up in the community. If the first time you don't see a lot of people, it's not because you're doing a terrible job. It's, they're still trying to understand what it is that you're doing and why you're in their community. Yes, food is great too.
Yeah, I was going to say, for folks who can't see the chat, I think food, at least culturally for us in Hawaii, and Anika could speak, food is so important and sometimes not allowed in certain funding things, right? So sometimes we call it training supplies or something.
Yes, right, right.
So just, figure out the workarounds, but, food, thank you, Sue, for mentioning that.
Right.
Really,
Or
vital.
we're having a sponsor provide the food because, our grants won't allow for that, but somebody's going to sponsor it. That's, very useful. In our African immigrant communities, it's very different too. Like we serve the Ethiopian, Ghanaian, Nigerian communities, and, there's no one size fit all for any of our communities. It really is about, do you understand the culture? Do you speak the language? And can you be trusted? And so, just because of your skin tone does not mean that you get an automatic in.
All right, thank you. So this was also a question from the chat. This may or may not be our last one. So the question is, have you been able to integrate TB screening with other screenings? And did you find any difference in doing TB outreach versus hepatitis B outreach?
I guess I'll take this. I actually have just been focused on the hepatitis screening, but whenever I come across TB or any other needs for other screening, I usually just refer patients to clinics where they can get tested. It's fairly simple, a skin test. But for the most part, Mongolian community, they will react and will require, x-ray. So, you kind of have to think further. You can't just tell them something and then they call you back again. Well, if this happens, that's what you need to do next. So, just kind of sort of gauge them into whatever pathway that they need to go. But yeah, I mostly focus on hepatitis.
Yeah, no, definitely crucial, but difficult to integrate both fields, right?
Both, yeah. For me, I think TB was definitely, okay, if I want to expand, if I had, infinite amount of time to dedicate myself, TB would definitely be my next cause that I would advocate for. Yeah.
Well, then now I have one more question. I lied, it was not the last question. What are some learnings now that can be utilized while working in the field of hepatitis B and or TB?
So this one is going to be related to providers. The hardest thing for us is the linkage to care and referrals after we screen and test. And so it's so important for us to be able to recruit providers that we can partner and work with. And, seriously, just yesterday, I went out and met with a new provider who was taking over a practice of one of our providers who recently passed away, unfortunately, but he was our champion. We were devastated to know that, his health wasn't doing well. And, it was so important that we reached out to this new provider that was taking over his practice and making sure that he's going to continue working with our hepatitis patients. And so that's extremely key in terms of lessons learned, and making sure that you have best practices is always making sure that there is somebody to take care of the patient after you screen and test, and they know that their status, and especially finding providers who can speak their language.
I can go next. So lessons learned. Well, first of all, I saw the comment in the chat from African Health Coalition, and I just want to echo and uplift that. And also just to note, we're speaking about our experiences in these specific parts of the country, but really, the diversity of our cultures that we're serving is so vast, right? And so we talk a lot about Asian cultures, but we haven't even talked about Native Hawaiian, Pacifica peoples, and of course our African partners as well. So just wanted to acknowledge that diversity. I think the lesson learned is maybe a broad one over many years doing this work, is what one of my mentors once said to me, which maybe might help everyone a little bit, is she once said to me, comparison is the thief of joy. And sometimes we hear this, all the cool stuff that people are doing, we're like, oh, why can't we do that? Or you feel kind of like, oh, I wish I could do that. But just to acknowledge, like, you are doing good work. You're doing fantastic work, actually. You're protecting your community, but you're just doing it in a different way with a different set of resources. So when you compare yourself to other programs, really just think about what you can learn from it, consider them as teachers rather than as like metrics to compete against. So that's something that I had to work on as well. I'll just kind of end with that because I think it's really helpful for me, doing this work for over 11 years in our community, to really think about that a lot and learn and grow from all the teachers around me.
For me, I think, lesson learned, I think doing the community work is that the language barrier we already mentioned, but, the varying degrees of English fluency. Just look at somebody seems to speak very good English. That doesn't mean they can offer good, health-related counseling or being able to translate things. So in some sense, I had to learn that, they don't know how to say hepatitis in Mongolian or vice versa. So even then I have to step in and explain to them, what it's called and why certain things. So yeah, I think that's the lesson I learned, like people don't have that varying degrees of fluency.
Anika, can I add one more lesson? I just thought of it as OU was
Yeah,
speaking too.
absolutely.
I'm still marinating and processing all the great stuff that they've shared. But really it's just when we think about social capital, right? And so really an investment in people is also an investment in time. And I think this was a theme that both OU and Amy had kind of alluded to, but really, the work will take time and it'll be beyond the time of our grant cycles typically, right? And I think the panels yesterday mentioned this too. But really just to acknowledge that the work will take time and that's okay. And you're really looking long-term rather than short-term grant objectives. So I want to acknowledge that time piece is really important as well.
Yeah, absolutely. It takes a lot of time.
Yeah, it seems that everybody agrees that this was an amazing discussion, full of insight and ideas. Coming back to the emerging practices, that is, I know you were also touching on that. So yeah, it's very apparent that there are still emerging practices still occurring, and that education is so important along with really relationship building, not only with the community, but partners all around the world as well. So I really just want to thank you so much to our wonderful panelists for providing their helpful insight on screening, testing, and vaccinating for hepatitis B and TB. And then I also would love to thank you all, the participants, attendees, for joining for the second session of the third day of the 2022 Hep B